stem cell transplantation, or the indications for stem cell transplantation in patients with Hodgkin lymphoma, have remained quite stable over the last few years. So basically, we are considering autologous transplants for those patients that are primarily refractory or that are in a first relapse after first-line conventional chemotherapy. Over the last few years, we have been able to improve the results of autologous stem cell transplantation, basically by increasing the percentage of patients that achieve a metabolic complete remission with the first-line salvage chemotherapy and with the use of consolidation strategies after autologous stem cell transplantation in those patients that are at a high risk of relapse. Maybe in the future, we will be able to avoid autologous stem cell transplantation in patients with primary refractory or with relapse disease that achieve a metabolic complete remission with salvage strategies by substituting autologous stem cell transplantation by one or the other of the two new drugs that we have nowadays, or maybe not so new drugs, vedotin and checkpoint inhibitors. If we talk about allogeneic stem cell transplant, allotransplant has been basically dedicated to those patients that relapse after an autologous stem cell transplantation, and at least for the time being is the only curative strategy that we have for these patients. But in this specific setting, we have seen over the last few years the introduction of newer treatments, as I have mentioned before, Brentuximab vedotin and checkpoint inhibitors. Very effective treatments with a lower toxicity or a better toxicity profile in comparison with allogeneic stem cell transplantation. And this has made the numbers of allogeneic stem cell transplantation decrease over time, and also move the allogeneic stem cell transplantation indication to later phases of the disease. Although we know that the combination of checkpoint inhibitors and then an allogeneic stem cell transplantation to consolidate the results of checkpoint inhibitors are able to give really very interesting results.